those repertories which doesn't follow any single schema. Because when the Medica was getting enlarged because of ever increasing number of drugs, our stalwarts thought about creating a book which will contain all these symptoms, to which will actually help to read and understand and apply the Medica in bedside. That was a real thought from which the concept of repertory came. Now, this here is very important. Early repertory, middle time repertory, modern era of repertory is fine. What is pre-repertorial? These are all. You can
Just ये fruits
definitely
में
get
काट लें.
questions from here, and one is two question very frequently asked from this section. Number one, in 1805, Fragmenta de Viribus was published. The second part, that is per secunda. This contains the repertory section, not the first part. Now the thing is that in 1817, 1818, Dr. Hahnemann published actually it's unpublished repertory. He prepared another short repertory in Latin language. Invariably in the question they will give it in German language. And as because Hahnemann was mainly from Germany, it seems like he wrote in his native language, so the Germany will be the answer. No, the unpublished repertory was in Latin language. In 1826, Hartlub's systematic presentation of pure medicinal effects. Now, if you look at the names, you would see that these names does not represent any single pattern. Systematic presentation. They were just trying to prepare a schema, right? Now, in 1828, speaker, this is not that important. In 1830, Weber, systematic presentation of antisodic remedies. That is very important. We always think about repertoire of antisodic remedies when it comes to Boning Hussein. Now coming to Weber, he also prepared one repertory in 1830. Another one, Rackard, systematic presentation of homeopathic medicines known so far. So these are the repertories which belong to the pre-repertorial era, before 1832. Clear. So the important question perspective, 1805, Fragmenta de Viribus, that is one of the first work of Hahnemann. In the second section of Fragmenta, we have the repertory section. The unpublished repertory, 1817, it was in Latin language. It was a short repertory. In 1830, Weber prepared a repertory on the antisodic remedies. In 1830, Rackard also prepared, but this is not that important. But still, if you can remember, I think it's good. Okay. Now the next early repertoire. In 1832, Bonning-Hoshen's systematic alphabetical repertory of antisodic remedies. 1833, Glasser first alphabetical pocket repertory. Very, very important. These two has been asked many times. If you do MCQ, you will see 1833, another one is repertory of purely pathogenetic effect. Then 1835 jar, another one important repertory of the glands, bones, mucous membrane, ducts, and skin disease. Again in 1835 comes Bonning-Hoshen, not repertory of non-episodic remedies. In 1836, an attempt of showing the relative kinship of homeopathic remedies. Then comes 1838, the big bull, Constantine Herring, first English repertory of Allentown Academy. All these informations, like, there are barely any things which you can understand, because that's one of the good thing and also bad thing, because in repertory analytical part is pretty less. Its application, which is in the clinics, it needs a lot of brainstorming. But when it comes to attending MCQs in for examination, it's all about right information. So what we are doing in Homeo Adda, we are trying to give you a list of commonly used informations from where you are likely to get questions from. Understood. Now there is another one in 1840, Ralph Repertory of Homeopathic Medicines, nosologically arranged. In 1843, Lafitte, a homeopathic repertory of symptomatology. This is also very important. Now coming to BTPB 1846, we all know that it's a logico-utilitarian type of repertory. In 1849, Muller's systematic alphabetical repertory. So the first alphabetical repertory, Glasgow. Then comes in 1849, Muller. Another one important is B.F. Jocelyn, homeopathic treatment of diarrhea, dysentery, and cholera. The repertory especially focusing on the clinical symptom. Then comes Humphreys, treatment of diseases of sexual symptom. One of the first repertory which mainly focused on the sexual symptoms. Now comes Hempel's. It was refined Jar's work, Jar's alphabetical repertory of the skin symptom, external alterations of substance. Next comes 1851 Brand Pocket Manual of Homeopathic Medicine. Next, Posert Repertory of Characteristic Homeopathic Remedies. It was a general repertory. 1853, another important year, Jar's Symptom Codex. Many times this question has been asked, the Jar's Symptom Codex. Again comes Humphrey, Dysentery and its Repertory of Medicine. This is also a special repertory. So, if you look at Humphrey's work, first there is cholera in 1849, then there is dysentery and its repertory of medicine. Okay. Then comes Lippi's repertory, 1854, repertory of comparative materia medica. Among the 18 English homeopaths, Siffer repertory. It was a Puritan type of repertory, 1859. Again in 1859, you will see Jar's new manual of homeopathic materia medica with post-third edition. That is also a general repertory. Now coming to 1869, James Bell, homeopathic therapeutics of diarrhea, very popular amongst all of us. Again in 1869, Douglas, homeopathic treatment of intermittent fever. Now, can you all tell me which is there any Metra Medica for intermittent fever and who wrote the Metra Medica? Anyone? Therapeutics of intermittent fever?
Mm.
Anyone?
Allen,
Exactly. Very good.
W.
So,
Allen.
very good. WLN. Homeopathic therapeutics of intermittent fever. And here comes 1869, along with Bell's diarrhea, we have homeopathic treatment of intermittent fever, not therapeutics, which was written by Douglas. Very good. So then come Dunham, Carol Dunham, homeopathic treatment of whooping cough. 73, Berry's repertory of the eyes. Like this question has been asked countless number of times. You won't even be able to count how many times it has asked who has written the repertory of eyes. E. Berridge. Okay. Cushing, leukorrhea and its concomitant symptom. Now there is a silly way to remember in our Metria Medica, you will get a term that gushing leukorrhea. You can remember with this leukorrhea, gushing leukorrhea, written by Cushing. So by this you can try to remember because so many things are there, na. So you have to make some mnemonics or something like jingles so that you can remember all those informations. Now coming to Kondorfer, Bonninghausen's therapy of intermittent and other fevers. It has been never asked in any exam. Now, in 1874, another very important for examination perspective, homeolexicon. Now, coming to 1876, Hart, repertory of the new remedies, Price, time remedies, Eggert, homeopathic therapeutics of uterine and vaginal discharges. So, in their Cushing's work, we see leukorrhea and its concomitant symptom, Listen, these are the certain things which you have to remember while you are studying again and again and again, so that you don't mm, make a mistake while you are attempting the MCQs. This is very important. Just one small mistake, it would be -1, and if you are cautious, +4 will be in your book. Okay, so for leukorrhea and its concomitant symptom, there is gushing, and for Eggert, homeopathic therapeutics of uterine and vaginal discharges. In 1879, Lippi's repertory of the more characteristic symptom, that is Lippi's repertory. 1879, King, headache and their concomitant symptoms. It is there. 1879, Guernsey, repertory of menstruation. Guernsey has written quite a few number of repertories. So from Guernsey, what you get is which of the following is not written by Guernsey. So you have to remember there is menstruation, there is mastitis, there is like that. We will see. Now comes H.C. Allen Therapeutics of Fevers, and that W. Allen is the Metra Medica. Now Rollin G. Gray, an illustrated repertory of pain in chest, sides, and back, their direction and character. T.F. Allen, Symptom Register, we all know that, we have read it in our final year. Samuel Worcester, Repertory of the Modality. Now, this also you can remember in Metria Medica what we see. Worse. So, Worcester, modality. Who has written the Repertory of Modality? Worcester. Whether you are good or worse. So, worse is a type of modality. So, Worcester has written the Repertory of Modality. Okay. Now coming to Herring's work, analytical repertory of the symptoms of the mind. Then Brigham, catarrhal diseases of the nasal and respiratory tract. Repertory of the characteristic symptom. That this is the one actually I was looking for. So that's the difference. If there is most characteristic symptoms, it is 1886 Winterburn. If this is not most repertory of the characteristic symptoms, it is Lee 1889. Now, can anyone tell me what is Lee's another Schussler's 12 tissue remedy? Then comes repertory of symptom of ovaries, CM Boger. Then OM Drake, repertory of foot sweat. Holocomb, repertory of the symptoms beginning with sensation as if. Now, who have written repertory of sensation as if? Anyone?
Robert.
Sorry?
Robert.
H.A. Robert.
Very good.
Robert.
So
H.A.
H. A.
Robert.
Roberts, repertory of sensation as if. And repertory of the symptoms beginning with sensation as if, A.W. Holocomb. So these are certain areas actually which you have to focus while you are studying for attending MCQs. Like these are certain areas where you are likely to make mistakes, right? So the names are very close to each other. Then Yingling, repertory of appendicitis. This is also very, very important. Many times it has been asked. Then Edward Rushmore, repertory of scarlet fever. Then again Yingling, Accuser's Emergency Manual. Then Holocomb's another work, Repertory of Spasm and Convulsion. Then Nard's Repertory on the hearing guiding symptom. Then Douglas Repertory of tongue symptom. C.C. Boyle, Therapeutics of Eye. So, Repertory of the Eye, Berridge, Therapeutics of Eye, C.C. Boyle, and I would request all of you from next time try to join within the time. I always give a span of 15 minutes from 6:45 to 7 to join the class, because as you try to come in the middle. Now coming to Wilsley, 99 repertory of the back. Very important. All in M. Drake, repertory of words and condylomata. This is also very important. Next comes HC Moro, the bed feels hard. The repertory itself represents a symptom. Okay. Pulford, repertory of the symptoms of rheumatism and sciatica. Previously, we have seen repertory of sciatica, right? No, Simon's notes on sciatica, 1892. You can see here Simon's notes on sciatica. In the middle time repertory, what we are getting a improved version, that is CM Bogart, the homeopathic Pulford, repertory of the symptoms of rheumatism and sciatica. Okay. Now, this is also a special repertory. Now, then comes CM Bogart, homeopathic therapeutics of diphtheria. Very, very important. Again comes F.H. Lutze, the therapeutics of facial and sciatic nerve, with repertory and clinical cases. Again, another one on sciatica. Simons we have seen, Pulford we have seen, and Lutze is here as well, which has facial and sciatic nerve. Next comes Morgan, repertory of the urinary organ and prostate, including condylarthropathy. So Minton, we have uterine therapeutics. With Morgan, we have repertory of urinary organ and prostate, including condylomata. Then come 1900s CM Boger's work, systemic alphabetical repertory, which is actually the English translation of Bonin Hussein's repertory of antipsychotic remedies. You all know that. That is also very important. Next comes Clark clinical repertory. You all know that. Ostrom, disease of uterine cervix. C.C. Boyle. We have seen therapeutics of eye. Again, C.C. Boyle, homeopathic therapeutics of ear. C.M. Bogart, BBC, we all know that in 1905 it was published. Then comes Pierce, repertory of cough, better and worse. Shades clinic repertory, not that important. 1909, E.B. Nash, leaders in respiratory organ, very, very important. H.I. Ostrom, leukorrhea and other varieties. That is also not that important. In 1915, C.M. Bogart, synoptic key to homeopathic mitra medica, very important. Then comes Moffat, homeopathic therapeutics of ophthalmology. So with I, how many repertory we have seen? Anyone? Anyone? Anybody? How many repertory we have seen with eyes? Two you can remember, right? Berry's eye, C.C. Boyle therapeutics of eye. Again, we have got J.L. Moffat, homeopathic therapeutics of ophthalmology. That is also related to eye. So till now, three. Now again, Lutz repertory of symptoms of respiratory organ. Then Vandenberg, therapeutics of respiratory system. That is very confusing actually. Leaders of respiratory organ, repertory of the symptoms of diseases of respiratory organ, therapeutics of respiratory system. So these are quite confusing, but we will make it, don't worry. Then comes 1927, Boric's clinical repertory. 1929, N.M. Chaudhuri Metroamerican repertory, not important. Then comes 1837, H. A. Roberts, Sensation as if. 1839, another important work, Rheumatic Medicines. 1839, Alfred Pulford, Repertory of Leukorrhea. So just remember, whenever you are studying, try to take the note of these things. How many repertory related to leukorrhea is there? How many repertory related to sciatica is there? How many repertory related to eye is there? So when you are studying, if you try to locate these things in a separate place, you will never get confused because there are small, small terminologies. Years you can differentiate after certain time. Okay, this is middle time, so it would be between this year to this year. This is early repertory, so it will be between this time to this time, like that. बट क्या होगा जब आप एक जगह पे लिख लोगे कि रिलेटेड टू आई these 5 repertories are there, related to leukorrhea These three repertories are there. Or Guernsey has written these six repertories. तब जाके all except cross matching आपके लिए easy हो जाएगा. Understood? This is the reason why we are discussing all these things. Otherwise, we can easily give a study material which you will study of your own. But that's not the fact. When you hear these things repeated times, when you see these things repeated times, then it will be easy. It will set in your mind, and you will be able to answer it quite easily. Understood? So try to do these things from the very beginning. Don't push it for later. Like, there are certain strategy which I will discuss with you after you join for pathology, microbiology, parasitology, as well as I'm taking care of that subject too. And for repertory, everybody says repertory is very difficult. Not that. You can easily do that. But what you have to do is you must have a specific strategy, because this is not possible. Even I also don't remember all the years. But if you give me an MCQ, just because I'm accustomed with all these things, at least I'll be able to recall which one to do, which one not to do. But I might get wrong as well. It's not that these things are happening with you only. So don't be confused, okay? So coming to next one, Pulford's work, Repertory of Leucorrhea, 1963. Very important. S.R. Patak, a concise repertory of homeopathic medicine. Then comes Stephenson's Hahnemannian Provings, Amateur American Repertory. That's the only repertory which refers to Hahnemannian Provings. Kindly keep that in your mind. Stephenson, 1963. Next comes to modern repertory. That is 1970 onwards. Okay? Aversion. So, is there any other repertory related to desire and aversion we have seen? Anyone?
Yes, sir. Yes, sir.
What is the
My
big?
doctor gonna say,
Very good. So, and repertory of modalities?
Worcester ऐसे कुछ बता.
Very good. Worcester.
Yes.
So, what's your name? Anuradha. Right? Where are you from?
Noida.
Anuradha? Noida. Okay. You're doing good. Very good. So, let's start with modern repertories. All the other students, I would request all of you kindly try to respond. Okay? It would be better because it's not possible to see it all of you in person. So if you communicate, I will be able to understand what doubt you actually have. Otherwise, I won't be able to help you out in your preparation. So try to communicate as much as possible. Now next comes modern repertory. You all are aware with all the names: Barthel and Clanker's synthetic repertory, Y.R. Agarwal repertory of desire and aversion, and Anuradha has likely said about the other one. Then comes Solar Medina, not an important repertory for MCQ purpose. Another one important is 1990, Hunsley's Kent's Repertorium generally. Okay. 1993, Frederick Strand's Synthesis. 1993, Robin Murphy, Homeopathic Medical Repertory. 1995, Mirili, Thematic Repertory. So, what is the base of thematic repertory? Anyone? What is a thematic repertory? Anybody?
No,
Anyone?
no idea, sir.
Thematic repertory is a repertory which is based on a specific theme, that is Bernal's thematic mathematica. Okay, so that's why the name thematic repertory has been given. This is a special type of repertory which is based on a specific theme. Kindly keep that in mind. So if you get a MCQ that what is the principle of thematic repertory, there is no specific mental theme or physical, general or particular, not like that. It is based on Bernal's thematic mathematica. That's why it is called as thematic repertory. So you may get fooled. You may think thematic repertory, it may be based on mind, it may be based on certain area of the body. No, it is based on Bernal's thematic work. That's why called as thematic repertory, which follows a particular theme. Okay. Now come to Zandvoort. Zandvoort's complete repertory. 1999 JPS Bakshi, Phoenix Repertory. 2000 Jugal Kishore's Integrated Repertory of Mind. 2003 again Zandvoort Repertory Universally. Now coming to card repertory. I will come to card repertory. Before that, the thing which I have discussed about pre-repertorian era, uh, early repertory, middle time repertory, and modern repertory. Do you have any query or any confusion regarding this section? Though there is very little thing to understand, but still, if you have any query, I would be happy to answer. Anyone, if you have any query, please tell me. शर्मा मत, प्लीज बोलो भाई. किसी को कोई कुछ पूछना है कि इस सेक्शन के बारे में क्या करना है, कैसे करना है? Any doubt regarding any part of this which I have discussed? Okay, chalo. Coming to card repair, means we have a very limited time na, and find out the odd one. All of the following information about this card repertory is true except these kind of question. First, in 1888, Guernsey's card repertory, Alan Bonington's slip, Bonington's repertory based on Bonington's work, number of card 2500, number of medicine 126. Very important. Guernsey's work, Alan Bonington's slip, Bonington's repertory based on, and then 2500 card. Okay. Now, can you tell me if Guernsey has written it, then why the name Alan Bonington's sleep is given? Anyone? Why not Guernsey Bonington's sleep? बात करो यार जो भी.
So, because based on Boning Hassan repertory.
Then where did Alan come from? It is based on Bonington's repertory. It is given there. That is understood. Then what Alan did? Actually, Allen took up the word, which later on shaped by Garnsey. That's why, and Garnsey was humble enough to keep the name intact, and he kept it as Allen Bonington Slip. The name Allen Bonington Slip was given by Allen only, and Garnsey kept the name intact and modified the work. He increased the number of cars, number of medicines. That's why the number of medicines are still 126, which was in Bonington's work. But the number of cards got increased. If you see the history, you would get to know. Okay, we will study these things in detail in full class, but in the demo class, this is not possible to discuss all those things because we will have a separate class of 2 hours focusing on card repertories actually. Now, in 1912, Tyler's punched card repertory, first punched card repertory came into picture, that is based on Kent's repertory. 1,000 cards are there. In 1913, Welch and Houston loose punch card repertory based on Kent repertory, 134 cards, 348 medicines. Then Field's card repertory, which is based on three repertory, Kent's work, Boger work, and Skinner's work, 6,800 cards, 360 medicines. Then Boger's card index and general analysis based on Boger's synoptic key, 305 and 250 number of medicines. Jeminer's card repertory based on Bonington's work, 600 cards. Brazilian's card repertory based on Kent, 1861 number of cards and 640 number of medicines. In Weiss card repertory, fairly these are not that important. Then comes L.D. Dhaule card repertory based on Boger's work. Shankaran's card repertory based on Bogart, Kent, and Clark work. 420. Remember, remember the number. It's easy. 420. T. Shankaran is not 420, but the number of cards are. Number of medicines 292. Jugal Kishore, Kishore's card repertory, maximum number of cards 9987, and the number of medicines is 600. In 1984, Shashi Mohan Sharma's card repertory based on Kent's final general repertory, which has 3000 cards. Next, come to softwares. In softwares, we have a few. Like in 1976 and 97, the Lamina Homeopathic Repertory Analysis System. In 1979, George Bros lay repertorized the Kenti Milani based on Kent's wife's name. In 1981, Forefront Computer England Limited prepared Kara. 1987, George Shah developed HomePath, which we all use right now. In 1987, there is Frederick Stein's Radar, Mac for Apple, ISIS, not Islamic State of Iran and Syria. Okay, so you can remember that as well as a mnemonic. Now comes Jose Isaac, Similia, R.P. Patel developed Kentian, Dr. Dixit developed Organon 96, and CIRA Homeopathic Repertory System, HRS. Now we will do some questions from this section. Before that, there is also another software based repertory, that is Vitulka's Compass. Actually, I forgot to include that as well. Kindly remember that in your full length class we will discuss about that as well. Vitulka's Compass, you may get question just for few informations. So if you get question, you will not miss it, because in India many